Hello, my name is Stephanie Ochoa. I still haven't received my scrubs yet. Okay, mom, so I know pregnancy is an exciting time, and it's also a time, to be a little more careful about what goes into your body and what you're exposed to. And these are the recommendations that are here to kind of protect you and baby in a way. So, to not make things stressful, I'm gonna explain to you a couple of things. So, foods to avoid during pregnancy, and it has a reason why. Some foods can carry, bacteria or chemicals that may harm you and the baby. For example, that could be foods that are, raw or undercooked. Meat, eggs, and seafood can contain bacteria like salmonella that can cause like kind of like serious infections. Deli meats like hot dogs, unless heated until it's steaming. Risk of listeria, which can cause miscarriage or preterm. Unpasteurized milk and soft cheeses like feta, queso fresco, something like that can be very harmful. Um, um, which may contain like harmful uh, you know harmful or too much bacteria or high mercury, like fish like shark, swordfish, king mackerel. Those are just examples. Mercury can affect the baby's brain and development, and we don't want that. um, you know Raw sprouts can carry bacteria that are hard to wash away. And over-the-counter OTC medications and supplements, some medications are safe in pregnancy while others can affect your baby's growth and development. OTC medications that are generally safe or like Tylenol, which are for like pain or fever, or antacids like Tums for like heartburn, because pregnant moms suffer through a lot like that. Saline nasal sprays or congestion. Vitamin 6 may help with nausea. They are commonly used because they do not interfere with baby's development, when used as directed. But I would suggest to always ask your primary care doctor, always, to make sure it's okay depending on the situation or what's going on. Over-the-counter medication to avoid would be ibuprofen, Advil, Motrin, Naproxen. This all can affect babies' kidneys and heart, especially later in pregnancy. Aspirin, unless prescribed, may increase, bleeding risk. Cold medicines also, you know, or, all of that could be pretty bad, like phenylephrine, anything that contains like that, phenylephrine. So, and what can reduce blood flow to the placenta would be like herbal remedies. Many are like unregulated and may cause urine contractions or harm the baby, and we don't want that. And supplements that are safe and recommended, of course, it would be prenatal vitamins. Folic acid is a must, iron is a must, calcium, vitamins, vitamin D. Some people say also vitamin C, a lot of that. Avoid extra supplements unless it's needed, like high doses of vitamin A or weight loss, or detox supplements. Too much of certain vitamins can be just as harmful as no vitamins. So just make sure you're not like overdosing on anything or you're double taking on anything. Environmental exposures to avoid during pregnancy would be like lead, like old paint, contaminated water, which can also affect baby and the baby's brain and the nervous system, and we definitely don't want that. Like cat litter, like a lot of people have cats, which can cause birth defects. Strong chemicals, cleaners, pesticides, they may increase the risk, of a miscarriage or birth defects, and we don't want that. And of course, they always say no alcohol, no tobacco, no substance use risk to the pregnant person. And high blood pressure problems or placental problems, increased risk of miscarriage, which risks, the baby. Alcohol is a fatal spectrum of disorders and could cause many things like behavioral problems, people who smoke, it's low birth weight, premature birth, breathing problems, drugs, withdrawal symptoms, growth restrictions, developmental delays. So there's like no safe amount of any of that, when it comes to alcohol, tobacco, or drugs during pregnancy. And then travel, during pregnancy, that's, it depends on the safest time for you to travel. Second trimester, 40 to 28 weeks, energy is better, and risk of, complications is lower. Travel precautions: wear a seatbelt, under the belly, stay hydrated in a way, walk and, stretch a little bit. Nothing too much, maybe like a little walk. Every 1 to 2 hours, wear compression socks, since during pregnancy you get really swollen. Places to avoid: areas with infections, increased outbreaks, places without, access to medical care. What if you have an emergency and you have to go? You know, so when is not safe to travel? High risk pregnancy, signs of preterm labor, very important. Severe swelling or high blood pressure, like I said before. Risk of sitting for too long, that could cause blood clots. Increases risk of blood clots, and movement improves, circulation, and prevents all those complications. So I really, really recommend for that. Dental care during pregnancy is the best time to visit the dentist, because you don't want problems, especially, second semester is the safest and most comfortable, since you're not so nauseous. Dental procedures, cleanings, and fillings are safe. But when it comes to getting x-rays, they are okay with proper like shielding in a way, when they put the whole thing to cover your stomach. Common dental issues in pregnancy: bleeding gums and gum inflammation is typically seen. And, kind of like increased risk of cavities due to vomiting or cravings, or just try to have good oral health to help prevent all those problems, pretty much. And, to end our visit, you don't have to really remember everything perfectly. I am will definitely repeat anything you ask. I'm gonna go ahead and give you a pamphlet. Just try to focus, small healthy choices, and ask for help when you need. And you're doing something amazing by growing a whole human, and I wish you the best. Thank you.